What if your body has been quietly trying to warn you, but the signals are so small, so gradual, that they're easy to brush off? Let me ask you something. Have you ever noticed that you're going to the bathroom a little more often than you used to? Maybe you wake up once, then twice, during the night. At first, it doesn't seem like a big deal. You might tell yourself, well, I guess this is just part of getting older. And in many cases, that can be true, but not always. Sometimes, these small changes are your body's way of saying, something isn't quite right here. Think of it like a warning light on your car dashboard. It doesn't mean the engine has failed, but it does mean something needs attention. Now here's where it becomes important. With prostate cancer, especially in its early stages, the signs are often very subtle. They don't come suddenly. They don't feel dramatic. Instead, they show up slowly, quietly, over time. A weaker stream when you urinate. A feeling that your bladder isn't fully empty. A need to go again shortly after you just went. Many men ignore these signs, not because they don't care about their health, but because the changes feel small, and small changes are easy to overlook. But here's the reality I want you to understand. In some cases, these early signs may be your body trying to get your attention. Not to scare you, but to alert you. Because the earlier something is noticed, the more options you usually have. So as we go through this video, I want you to think about your own experience. Have you noticed any of these small changes? Have they been happening more often lately? Just keep that in mind, because awareness is the first step toward protecting your health. Hello, I'm Dr. Robert Miller. Over the years, I've spent a great deal of time reviewing medical research. But more importantly, I've spent time talking with patients, many of them over the age of 60, who simply want clear, honest answers about their health. And I've noticed something important. A lot of people are not lacking information. They're overwhelmed by it. Medical terms can sound complicated. Advice can feel confusing. And sometimes, it's hard to know what actually matters. That's why I approach things a little differently. My goal is not just to share information. My goal is to translate that information into something practical. Something you can actually use in your daily life. Think of me not just as a doctor, but as someone sitting across from you, explaining things in plain language. No complicated jargon, no unnecessary confusion, just clear explanations that help you understand what's happening inside your body. Because when you understand your body, something important happens. You begin to notice changes earlier, you ask better questions, and you feel more confident making decisions about your health. Especially after the age of 60, this becomes even more important. Your body may not always behave the same way it did years ago. Signals can become more subtle. Symptoms can overlap with normal aging. And that's exactly why clarity matters. So in this video, I'm going to walk you through this step by step, calmly, clearly, and in a way that makes sense. Now, before we go further, I want to take just a moment. If you find this kind of explanation helpful, simple, clear, and based on real medical understanding, consider subscribing to the channel. This channel is designed specifically for people over 60, people who don't want complicated lectures, people who want straightforward guidance they can actually use. By subscribing, you're helping us continue to create content that focuses on your health, your concerns, and your stage of life. And more importantly, you'll continue receiving information that may help you notice small changes early, before they become bigger problems. So let's talk about what we're going to cover today, because I want you to leave this video feeling informed, not overwhelmed. First, we'll talk about what prostate cancer actually is, not in complicated medical language, but in a way that makes sense in everyday terms. Then, we'll look at why this condition becomes more common as men get older. Why does age play such a big role? What changes inside the body over time? Next, and this is very important, we'll go over the warning signs, the small signals your body may be giving you. Some of these signs are easy to miss. Others may seem like normal aging, but understanding the difference can be very important. As we go through them, I want you to ask yourself, have I noticed this in my own body? Finally, we'll talk about simple, practical habits. Not extreme changes, not complicated routines, just realistic steps that may help support prostate health over time. Things you can actually do in your daily life. Because at the end of the day, Information is only useful if you can apply it. So take your time as you listen. There's no rush. Think of this as a calm conversation about your health. And by the end of this video, you'll have a much clearer understanding of what your body may be trying to tell you and what you can do about it. Let's slow this down and start with the basics, because once you clearly understand what the prostate is, everything else begins to make more sense. The prostate is a small gland found only in men. It sits just below the bladder, and it wraps around a tube called the urethra. That's the tube that carries urine out of your body. Now, instead of thinking of it as something complicated, picture this. Imagine a soft rubber ring wrapped around a garden hose. The hose is your urine flow. The ring is your prostate. When everything is normal, that ring stays flexible and doesn't interfere much with the flow. But as men get older, that ring often starts to grow. And this is very important to understand. Not all prostate growth is cancer. In fact, many men experience something called benign enlargement, which simply means the prostate gets bigger with age, but it's not dangerous. However, even normal enlargement can begin to press on that hose, making it harder for urine to pass through smoothly. This is why many men over 60 notice changes like a slower stream, needing more time in the bathroom, or feeling like they didn't fully empty their bladder. Now here's where prostate cancer is different. With prostate cancer, the issue is not just size. The issue is how the cells behave. Inside your body, cells are constantly growing and replacing themselves in an organized way. Think of it like a well-managed construction site. Old cells are removed, new cells are built. Everything follows a plan. But with cancer, that system breaks down. Some cells stop following the rules. They begin to grow uncontrollably, without order, without stopping. Over time, these abnormal cells can form a lump, or what we call a tumor. Now here's the challenging part. In the early stages, prostate cancer often grows very slowly. So slowly, in fact, that many men don't notice anything unusual at first. No pain, no dramatic symptoms, just small changes, if any at all. And this is exactly why awareness matters so much, because when something grows quietly, it's easy to miss. Let me ask you this. If a problem develops slowly over months or even years, would you notice it right away? Most people wouldn't. That's why understanding these early changes is not about fear. It's about awareness. It's about learning how to recognize when your body is trying to tell you something. Now, let's connect this to what research has shown. Medical researchers, including those at organizations like the National Cancer Institute and Harvard Medical School, have studied prostate health for many years, and one finding comes up again and again. Prostate cancer is one of the most common cancers in men over the age of 60. But here's the part I want you to focus on. Many of these cases are found early, and when prostate cancer is found early, the outcomes are often much better. In simple terms, early detection gives you more options, more choices, more control. But here's the challenge. Early signs are often very subtle. They don't feel urgent. They don't interrupt your life dramatically. They show up quietly. A small change in your routine, a slight difference in how your body feels. And because these changes can also happen with normal aging, many men assume everything is fine. They wait. They ignore it. They adjust to it. But research consistently shows that paying attention to these small changes can make a meaningful difference. So again, this is not about being alarmed. It's about being aware. Now let's walk through what's actually happening inside the body. I'm going to keep this very simple and practical. Let's go back to that garden hose example. Your urethra, the tube that carries urine, is like that hose, and your prostate is like a ring around it. Now imagine someone slowly tightening that ring. Not all at once, but gradually. At first, you might not notice much, but over time, the flow through the hose becomes weaker. It takes longer for water to come out. And that's exactly what happens inside the body. As the prostate grows, whether from normal aging or cancer, it begins to press on that tube. This pressure can cause a weaker urine stream, difficulty getting started, stopping and starting while urinating, or the feeling that your bladder isn't fully empty. Here's a simple real-life example. You go to the bathroom, finish, and then a few minutes later, you feel like you need to go again. That's often because the bladder didn't fully empty the first time. Now, why does this matter more after 60? Because the prostate naturally tends to grow with age, so these changes become more common. But that's also why they're often ignored, and that's where awareness becomes important. Now let's talk about something less obvious, your body's communication system. Your bladder and prostate are connected to your brain through nerves. These nerves act like messengers. They tell your brain when your bladder is full and when it's time to go to the bathroom. Under normal conditions, this system works smoothly. But when there's abnormal growth in the prostate, it can interfere with these signals. Think of it like a phone call with bad reception. The message is still being sent, but it's not clear. This can lead to sudden urges to urinate, feeling like you need to rush to the bathroom, waking up multiple times at night, or difficulty controlling the flow. Let me ask you this. Have you ever felt like the urge to urinate comes on very suddenly, almost out of nowhere? That can be part of this signal disruption. And again, this becomes more common with age. The communication system becomes less precise, so even small disruptions can have a noticeable effect. Now let's talk about the third mechanism, irritation. When abnormal cells grow, they can irritate nearby tissues. This irritation is similar to how your skin feels when it's inflamed, sensitive, uncomfortable, easily triggered. Inside the body, this can show up as a burning feeling during urination, discomfort in the lower pelvic area, or unusual symptoms like blood in urine or semen. Now, these signs are less common, but they are more serious because they suggest that the tissue is being affected more directly. And this is where I want to be very clear. If you ever notice blood in your urine, even once, that is something you should not ignore. It doesn't always mean cancer, but it does mean something needs to be checked. So let's bring this all together. The prostate sits in a very important position in the body. Even small changes can affect how you urinate. And with prostate cancer, many of these changes happen slowly, quietly, over time. That's why the goal is not to panic. The goal is to notice patterns. Small changes that persist, changes that feel different from your normal. Because your body often gives signals early, you just have to know how to recognize them. Now let's take a closer look at this third mechanism, because this is where the body sometimes gives clearer signals. When cancer cells grow inside the prostate, they don't just stay quiet forever. Over time, they can begin to irritate the surrounding tissues. Now, what does irritation really mean here? Think about when your skin becomes irritated. It might feel sensitive, slightly painful, or uncomfortable when touched. A similar process can happen inside your body. The tissues around the prostate become more sensitive, and because this area is closely connected to the bladder and urinary system, even small irritation can lead to noticeable symptoms. For example, you might feel a dull discomfort in the lower pelvic area. Not sharp pain, but a sense that something doesn't feel quite right, almost like a pressure or heaviness. Some men describe it as a feeling of fullness or mild aching. Now let me ask you this. Have you ever felt a slight discomfort in your lower abdomen or pelvic region and just ignored it? Many people do. Because it's not severe, it's easy to dismiss. But persistent discomfort is your body's way of asking for attention. Another possible sign is a burning sensation during urination. This can feel similar to what people experience with a urinary infection. But in this case, it may be due to irritation caused by abnormal growth. The tissue becomes more sensitive, and even normal urine flow can feel uncomfortable. Now, I want to talk about one sign that is especially important, and that is blood in urine or semen. Even a small amount, even if it happens just once. This is something you should never ignore. Now, to be clear, this does not automatically mean cancer. There are other possible causes. But it does mean that something is not normal, and it needs to be evaluated by a doctor. Here's the key point I want you to remember. These symptoms are less common, but when they do appear, they are more serious signals from the body. They are not subtle anymore. They are your body saying, please pay attention. So if you notice ongoing pelvic discomfort, burning when urinating, or any sign of blood, don't wait. Have it checked, because early action can make a meaningful difference. Now that we've talked about what's happening inside the body, let's shift to something very important. What can you actually do? Not complicated treatments, not extreme changes, just simple, realistic habits that support your body over time. Because small daily actions, done consistently, can have a powerful effect. Let's walk through this step by step. Water plays a key role in keeping your urinary system healthy. It helps flush out waste and supports normal bladder function. But timing matters. If you drink large amounts of fluid late in the evening, your body will process that fluid during the night, which means more trips to the bathroom and interrupted sleep. So here's a simple approach. Drink most of your water earlier in the day. Stay well hydrated in the morning and afternoon. Then gradually reduce fluid intake in the evening. This doesn't mean avoiding water completely. It just means being mindful of timing. Better hydration during the day, better sleep at night. Now let's talk about movement. Many people think they need intense exercise to improve their health. That's not true, especially after 60. Your body responds very well to gentle, consistent movement. Think of movement like circulation support. When you move, blood flows more effectively through your body, and that includes the pelvic area and prostate. Simple activities are enough. A daily walk around your neighborhood, light stretching in the morning, even standing up and moving around every hour. Let me ask you this. Do you spend long periods sitting during the day? If so, even small breaks can help. Movement doesn't have to be complicated. It just needs to be consistent. Now let's talk about weight, especially around the abdomen. Excess weight in this area is not just about appearance. It's closely linked to inflammation in the body. And inflammation plays a role in many chronic conditions, including prostate issues. Think of inflammation like a low-level fire inside the body. It doesn't always cause immediate symptoms, but over time, it can affect how your body functions. Even small changes in weight can help reduce this internal stress. You don't need drastic weight loss. Even a few pounds can make a difference. The goal is gradual, steady improvement. Now let's look at diet. Highly processed foods can increase inflammation. These are foods that have been heavily modified, packaged, and often contain added sugars, unhealthy fats, and preservatives. Examples include processed meats, packaged snacks, sugary desserts, fried fast foods. Now, this doesn't mean you have to eliminate everything at once. That's not realistic. Instead, think in terms of balance. Ask yourself, can I reduce this, even slightly? Maybe you replace one processed snack with something simpler. Maybe you cook at home one more time per week. Small changes add up over time. Finally, let's talk about something very simple, but often overlooked. Listening to your body. When you feel the urge to urinate, don't ignore it. Holding urine for long periods can place extra strain on the bladder. Over time, this can affect how well the bladder functions. Think of it like this. If you keep delaying something your body needs to do, the system becomes less efficient. So try to respond to your body's signals in a timely way. Not urgently, but not delayed either. Here's what I want you to remember from this section. You don't need complicated routines to support your prostate health. You need consistent, simple habits. Stay hydrated at the right times. Keep your body moving. Manage your weight gradually. Make better food choices over time. And listen to your body's signals. These are small steps, but when practiced daily, they can support your health in a meaningful way over the long term. And that's what truly makes a difference. Now let's talk about something very practical. Your everyday food choices. Because what you eat regularly can either support your body or quietly work against it over time. And the good news is this, you don't need a complicated diet. You just need to understand which foods gently support your body's natural systems. Let's go through a few key examples. Let's start with something simple, tomatoes. Tomatoes contain a natural compound called lycopene. Now that may sound like a technical word, but here's what it really means. Lycopene acts like a protective shield for your cells. Think of it like a rust protector for metal. Over time, your body is exposed to wear and tear, what we call oxidative stress. That's just a way of saying your cells go through damage as part of normal aging. Lycopene helps protect prostate cells from that kind of damage. And here's something interesting. Cooked tomatoes, like tomato sauce or soup, often provide even more of this protective compound. So something as simple as adding tomatoes to your meals can be a helpful step. Next, let's talk about fatty fish. Examples include salmon, sardines, and mackerel. These contain omega-3 fatty acids. Now, what do omega-3s do? They help reduce inflammation in the body. Remember earlier when we talked about inflammation being like a low-level fire? Omega-3s help calm that fire. They support a more balanced internal environment. Let me ask you this. How often do you eat fish in a week? Even adding fish once or twice a week can be beneficial. It doesn't have to be daily, just consistent. Now let's move to leafy greens. Foods like spinach, kale, and similar vegetables. These are rich in vitamins and natural plant compounds that support your cells. Think of them as maintenance support for your body. They don't work overnight, but over time, they help your cells function more smoothly. And here's something important for people over 60. As we age, our body becomes less efficient at repairing itself. So giving your body the nutrients it needs becomes even more valuable. A simple side of greens with your meals can go a long way. Now let's talk about nuts and seeds, especially pumpkin seeds. These contain nutrients like zinc and healthy fats that support prostate function. You can think of them as small but powerful, easy to add to your daily routine. A handful of nuts as a snack, a sprinkle of seeds on your food. Simple, but effective over time. And again, consistency matters more than quantity. Finally, let's talk about green tea. Green tea contains natural compounds that support cellular protection. In simple terms, it helps your cells stay healthier for longer. Some people like to replace sugary drinks with green tea. That alone can be a helpful change. Now, you don't have to drink multiple cups a day. Even 1 cup regularly can be part of a supportive routine. Here's what I want you to remember. You don't need a perfect diet. You need a supportive pattern. Small choices, repeated daily. Adding more of these foods gradually can help support your body over time. Not instantly, but steadily. Now let's talk about something that's often misunderstood. Timing. Because one of the biggest mistakes people make is expecting quick results. They make a change, and then a few days later they wonder, why don't I feel different yet? But your body doesn't work that way, especially after the age of 60. Your body responds more gradually, and that's completely normal. So let me walk you through what a realistic timeline looks like. In the first few weeks, changes are usually subtle. You may not notice dramatic improvements, but small things can begin to shift. You might feel slightly better overall. Your digestion may feel more stable. Your energy levels might improve just a little. These are early signs that your body is responding. Think of this stage as laying the foundation. Nothing dramatic, but something is starting. Now, as you continue these habits for 1 to 2 months, more noticeable changes may begin. Your urinary patterns may start to feel more stable. You might notice fewer nighttime trips to the bathroom, slightly better control, less urgency. Again, these changes are gradual. They don't happen overnight, but they build over time. And this is where many people start to feel encouraged. Now, this is where the real benefit happens. After several months of consistent habits, your body has had enough time to adjust. This is when long-term support begins. Your system becomes more balanced. Inflammation may reduce. Your overall health may feel more stable. And here's the key word: consistent. Not perfect, consistent. Let me ask you this. Do you need to follow everything perfectly every day? No, because perfection is not realistic. What matters is what you do most of the time. So here's what I want you to take away from this. Your body works slowly, but steadily. Small daily habits build over time. Not in days, not in a week, but over weeks and months. So be patient with your body. Stay consistent. And remember, real change is not about speed, it's about direction. And as long as you're moving in the right direction, you're doing something valuable for your health. Now, before we finish, I want to slow down and talk about something very important. Because everything we've discussed so far is about awareness and daily habits. But there are certain signs that should never be ignored. These are situations where your body is asking for medical attention, not just lifestyle changes. So let's go through this carefully. If you notice blood in your urine, even a small amount, even just once, that is something you should take seriously. Now, I want to be clear. It does not always mean cancer. There can be other causes, but it is not considered normal, and it should always be checked by a doctor. Think of it this way. If you saw something unusual in your car, like smoke, you wouldn't ignore it and hope it goes away. You would get it checked. The same principle applies here. Now let's talk about persistent pain. If you feel ongoing discomfort in your lower abdomen, pelvic area, or lower back, not something that comes and goes quickly, but something that stays or keeps returning, that's another signal your body may be giving you. Pain is your body's way of saying something needs attention, and the longer it continues, the more important it becomes to investigate it. Next, sudden changes in urination. We talked earlier about gradual changes, but if something changes quickly, over days or a short period of time, that's different. For example, suddenly needing to urinate much more often, sudden difficulty passing urine, or a noticeable change in flow. These are signs you should not ignore. Now let's talk about something that many people overlook: unexplained weight loss. If you are losing weight without trying, without changing your diet or activity, that can sometimes be a signal that something is going on inside the body. Again, it doesn't always mean something serious, but it does mean it should be checked. Now, let me ask you something. How often do people delay seeing a doctor because they hope things will improve on their own? It happens all the time, and it's understandable. No one enjoys medical visits, but early evaluation often leads to simpler solutions. Now, there's another important group I want to speak to directly. If you take regular medications, have diabetes, have kidney disease, or any long-term health condition, you need to be especially careful before making changes. Even something as simple as changing your diet or fluid intake can affect how your body responds, especially if medications are involved. So before making any significant changes, it's always a good idea to speak with your healthcare provider. Think of it as coordination, you and your doctor working together, not guessing, not experimenting alone, but making informed decisions based on your personal health situation. Now let's bring everything together, because I don't want you to leave this video feeling worried. I want you to leave feeling informed and in control. Here's the most important thing to remember. Your body is constantly communicating with you, not in loud, dramatic ways most of the time, but in small, quiet signals. A change in routine, a difference in how something feels, a pattern that wasn't there before. And especially after the age of 60, these signals can become more subtle. That's why awareness becomes so important. Not fear, not anxiety, just awareness. Because when you notice changes early, you give yourself more options, more time, more control. And let me say this clearly, not every change means something serious. Many symptoms we discussed can be related to normal aging or non-cancerous conditions. But the goal is not to assume. The goal is to stay aware. And combine that awareness with simple daily habits. Things like staying active, making better food choices, maintaining a healthy routine, and getting regular checkups. These are not dramatic steps, but over time, they can support your health in very meaningful ways. Think of your health like a long journey, not something you fix overnight, but something you support, step by step, day by day. And even small steps matter. Now, before we finish, I'd like to hear from you, because your experience matters. What was the most useful thing you learned in today's video? Was there something that made you think differently about your health? Have you personally noticed any of these changes we talked about, even small ones? Sometimes sharing your experience can help others realize they're not alone. And if there's a specific health topic you'd like me to explain in a future video, let me know. I read your comments carefully, and many of the topics I cover come directly from your questions. So your input truly shapes what we talk about next. Take care of yourself, pay attention to your body, and remember, small awareness today can make a big difference over time. I'll see you in the next video.